Doctor-patient conversation. Neck pain after a motor vehicle accident. Hi, Mr. Carter. I understand you've been experiencing neck pain. Can you tell me what happened?
Yes, I was in a car accident yesterday. It wasn't too bad, just a rear-end collision. But since then, my neck has been really stiff and painful.
I'm sorry to hear that, Mr. Carter. What you're describing is actually quite common after a car accident, especially in cases of rear-end collisions. Do you mind if I ask you a few questions about your symptoms?
Sure, go ahead.
Have you noticed if the pain is staying in your neck, or does it radiate down to your shoulders, arms, or hands? Do you feel any numbness, tingling, or weakness in your arms?
No, it's just in my neck. It's sore and stiff. But I don't have any numbness or tingling.
That's a good sign. Based on what you're describing, it's likely you're experiencing whiplash. Have you heard of that before?
Yes, I've heard the term,
Of neck pain from whiplash improve within a few weeks.
but I don't really know what it means.
Whiplash happens when your neck is suddenly forced to move back and forth, like during a car accident. This rapid movement can strain the muscles, ligaments, and soft tissues in your neck. It's one of the most common causes of neck pain after an accident. Does that make sense so far?
Yes, it does.
Why you're feeling pain and stiffness. The stiffness and pain you're feeling are due to inflammation and muscle tightness from the strain. This is your body's natural response to protect the area while it heals. But I want to make sure there's nothing more serious going on, so we'll monitor your symptoms closely. If the pain radiates to your arms, or if you develop weakness or tingling, we may need imaging, like an X-ray or MRI.
That makes sense. So, is this something that gets better on its own?
For most people, yes. Whiplash usually improves within a few weeks with proper care. Let's talk about what you can do to feel better. Steps to relieve neck pain. Here's what I recommend, Mr. Carter. Rest, but not too much. It's okay to rest your neck for a day or two, but staying active with gentle movements is important for recovery. Avoid keeping your neck in one position for too long. Heat and cold therapy. Since your accident happened just yesterday, applying an ice pack to your neck for 15 to 20 minutes several times a day during the first 48 hours can help reduce inflammation. After 48 hours, you can start using a heating pad to relieve muscle stiffness. Stretching and gentle exercises. Once the pain starts to improve, gentle neck stretches can help restore your range of motion. For example, turning your head side to side and tilting it up and down. Would you like me to show you some stretches?
Yes, that would be helpful.
Great. I'll walk you through them in a moment. Pain relief. Over-the-counter medications like ibuprofen or acetaminophen can help with pain and inflammation. But if the pain becomes severe or doesn't improve, let me know. Good posture. Pay attention to your posture, especially when sitting or working. Keep your shoulders relaxed and avoid slouching or straining your neck. Avoid sudden movements. Be careful with sudden or jerky movements, which can worsen your symptoms. When to seek further help. Mr. Carter, it's important to keep an eye on your symptoms. If you notice any of the following, let me know right away. Pain that's getting worse instead of better. Pain radiating to your arms, or any numbness, tingling, or weakness. Headaches that don't go away or feel severe. These could be signs of a more serious issue, like nerve compression or other injuries, and we'd need to investigate further.
Got it. Hopefully it doesn't come to that.
Takeaway. The good news is that most cases with proper care. Let's work on those stretches, and I'll check back with you in a week to see how you're doing. Does that sound okay?
Yes, thank you, doctor. I'll give it a try.